Welcome to the Future Tech edition of the Finding Genius podcast. Forget frequently asked questions, forget common sense, common knowledge, or Googling for information. How about advice from a genius in their field instead? 95% of people in any profession are good enough to be qualified and licensed. 5% go above and beyond. They become very good at what they do, but only 0.1% are the geniuses of their profession. Richard has made it his life's mission to interview the geniuses of their fields in areas such as AI, 3D printing, quantum computing, blockchain and Bitcoin, and more. Don't miss out on amazing podcasts with geniuses. Review us on iTunes or wherever you listen, and go to futuretech.findinggeniuspodcast.com and subscribe today.
Hello, this is Richard Jacobs with the Future Tech and Finding Genius podcast series. I have Dimitra Skondra. She's an associate professor of ophthalmology and visual science at University of Chicago. We're going to be talking about the microbiome and eye health and diseases and retinal diseases like age-related macular degeneration and retinopathy. So, Dimitra, thanks for coming. How are you doing?
I'm good. Thanks for inviting me, and thanks for taking that initiative for this new and upcoming field in the eye world.
Yeah, why are eyes and eyesight important to you? Why in particular do you like this field?
Well, because you cannot see, you cannot do anything.
That's true.
It's very hard. It's one of the eye field is one of these interesting fields that it's about quality of life. Yes, you don't usually die or feel sick from conditions in the eye, or as a retina specialist are very commonly diagnose systemic diseases through the eyes, and the eye is the first site that we can really help save someone's life. But it's something that really affects the quality of life, and that's how I came to my world as well. I had an eye infection when I was in med school, and I realized how much it impacts my life, and then I realized that this is what I want to do. But it's also a very fascinating organ because the retina in particular that I specialize in is part of the brain, and it's the only part of the brain you can directly take a lens and look at it and see how it looks. So in every other specialty besides maybe the dermatology or ENT, you have to do only indirect ways to imagine what's going on in the organ you're looking at. With the eyes, we have all the fascinating imaging tools, but we just pick up our lens and look exactly how things look. So looking at people's brains basically directly every day, it's pretty cool.
I wanted to talk a little bit about the microbiome of the eye because it's rarely discussed. I spoke to one other person. They said that there doesn't appear to be any microbes on the eye, but I guess under the eyelid there are. Like, what have you learned about it?
So when you talk about microbiome and eye disease, you need to separate basically the microbiome of the eye itself and the eye area, and then the extra ophthalmic microbiota, like the microbiota in the gut, or maybe the mouth, or even the nasal pharyngeal space, and how that affects the eye disease. So theoretically, the inside of the eye, like inside the retina, theoretically it's sterile. That means that if someone takes fluid from your eye and cultures it, you should not find any bacterial growing. But the surface of the eye, it's not sterile. But it's a very unique mucosa kind of like covering surface. So our skin or the mucosa in our mouth and our nose has a much more robust and diverse variety of microbes that consist of flora. But interestingly, the microbes in the surface of the eye, it's much smaller. There are much less species and there's a much less number of bacteria. And that makes it a very unique surface that's exposed to the environment with trillions of microbes floating around, but none of them can really stick and create a flora and a film. So in that sense, the surface of the eye is a very unique surface mucosa of the body. And there's some evidence that in diseases of the surface of the eye, like dry eyes, or diseases that it's autoimmune or inflammatory responses, like Steven Johnson, that the different composition of the microbiota on the surface of the eye can be associated with different severities of these of ocular surface disease states. But even that is still new. We don't know exactly the pathways. We don't even know exactly why the surface microbiota of the eye is so different than the mucosal microbiota of others. Some people is the tears, maybe something about the surface cells of the eye secrete beyond the tears, that it has antibacterial properties. We don't really know. And I've been talking with some microbiome scientists, nothing to do with the eye here, and they mentioned it's a very, unexplained paradox in the microbiota world, how the surface of the eye depends particularly of so much low biomass. Then the interesting part, and that's the part that I'm more fascinated about, is that how the different microbiota compositions in other parts of the body, and in particular the gut, which is the core of most of microbiota biomass, can affect organs distant from them. For example, the brain, the heart, and the skin and the immune system. And there is really, this is a very new field, and the concept of a gut-retina axis was initially introduced, or when I started talking about it a few years ago, people were thinking like, what are you talking about? Or how things in the gut can affect how things grow in the eye. But I think that's a more fascinating thing. And my speculation, my hypothesis, and the early evidence from my team and my work shows that indeed how the microbiota are composition and specific species lack or presence of different species can affect different pathways in the retina directly, even in the absence of disease.
So, all right, so what are some of the diseases in the eye that you study, and what's commonly thought as to the reason why they occur? And is there a new insight you're getting thinking about the microbiome of the eye? Maybe that affects, like cataracts, how do cataracts happen, and maybe the microbiome of the eye has to do with it. Who knows?
So the cataracts, I don't focus on the cataracts, but actually there is some evidence that microbiota control different lens composition. We don't know if how microbiota affect cataract formation, but there is some limited data out there that are already published by different teams that microbiota can also affect the different lipid and lens proteins composition. If that's visually significant or clinically significant, we don't know. The field is very, very new. I mean, if you go and look about microbiota and eye diseases, there's still not much papers, and most of them are on ocular surface microbiota and autoimmune diseases like uveitis. So one of the first diseases that actually paradigm of microbiome immune system, people working on uveitis, was basically its inflammatory autoimmune process of the eye. You know how people get rheumatoid arthritis and lupus, and they have inflammation in the joints and in different parts of the eye. You get inflammation in the eye itself and its inflammatory process. And for that part, is probably one of the most well-studied associations between gut microbiota and eye disease. And they found that microbiota can trigger inflammation and seem to play a key role in inflammatory processes in the front and the back of the eye. My team's focus is mostly in age-related macular degeneration using animal models, and also retinopathy of prematurity, which basically it's a disease that develops in very high-risk premature babies, that as they get a little older, like around 36 weeks, some of these very premature babies, they get very aggressive retinopathy with new vessel formation. And working with the microbiome scientists and neonatologists here, and also a pediatric ophthalmologist, Dr. Rodriguez, and the professor of neonatology, Dr. Erica Cloud, we found some first evidence that early gut composition of very high-risk premature babies may correlate with the risk for retinopathy prematurity. Regarding the age-related macular degeneration, which is the main focus of my lab team using animal models, we've seen that different microbiota status can affect specific pathways in the retina that play a key role in diseases like age-related macular degeneration and angiogenesis. So this is all, first, you need to proof of concept that what changes in the gut can affect the eyes. And you need to see how that all fits in the disease and the risk factors for disease before you design new ways to change the disease and prevent blindness.
Well, okay, so what happens in macular degeneration? What are the stages, and how does it happen?
So age-related macular degeneration it's a very common disease. It's at this point, 15 million Americans in the US have AMD, and it's expected to go to 25 by 2040, and they're expected to be 250 million patients in globally by 2040. So it's becoming a public health issue because we don't really have a prevention and we don't have a treatment except for one subtype, which is only the minority of the disease. So in the early stages, you get some deposits and you have some trouble with dark adaptation. But as you go to more advanced stages, you may develop other more thinning in the center, and then affects your vision and your sensitivity, but also the quality of your vision and the dark adaptation, like your adjustment to the dark. And then you develop even more advanced feeling that we'll call geographic atrophy, or basically you lose the tissue right in the center of your retina with the macula. Or you develop the wet macular degeneration, like you develop new vessels, and then you need treatment with injections of medicine, basically in your eye every month for the rest of your life, more or less.
Why would you lose tissue? Like, why would this degeneration happen?
We don't know. So that's the thing. It's one of these, the macular degeneration is always like big puzzle. It's a very complex disease and it's a multifactorial disease. So it's very well known for the past 10 years that we've done a good job identifying the genetic risks and the specific genetic mutations, especially in pathways involved with inflammation and lipid metabolism, that seem to increase your risk for macular degeneration. But that only accounts for up to 50% of the risk. The other seems to be more lifestyle and environmental. And we know that the diets and the environment and obesity and hip to waist ratio, things like that, cardiovascular risk factors can affect the risk for macular degeneration. And I'll give you an example. 15 years ago, I always find it fascinating not understanding what really causes the disease. So when I was in the lab as a postdoc, I studied the effect and how diet and genetic risk combined can affect in animal models, the macular degeneration. And we showed for the first time that ever reported that high-fat diet alone can exacerbate both the wet and the dry macular degeneration features in the animal model. And then the high-fat diet was combined with genetic risk and genetic predisposition. That effect was really even more exacerbated and accelerated. So that was the beginning of all this. That was like 15 years ago. Microbiome was not in our radar, especially in the eye world. But at the back of my mind, I always find it very fascinating how what you give the mice to eat affects how the vessels grow in the eye. And that was always at the back of my mind. And fast forward, here we are at Joint University of Chicago 2016, which is one of the leaders in the microbiome field, and start reading about what is, cutting edge research in my new institution. And I came across the work by Jin Chang, who's now a very close collaborator. But basically, he showed something similar to what I saw in the eyes in his colitis mice. So he's a gastroenterologist, and he studies Crohn's disease and inflammatory bowel disease. And he saw similarly that high-fat diet in combination with genetic predisposition will really exacerbate the features of the colitis in the animal models. And that was like mediated by gut microbiome changes, that the diet affects the gut microbiome and the gut microbiome affects the immune system, and that you have a more exacerbated disease manifestation. And it was more like a light bulb moment. I'm like, oh my God, this is why my mice 15 years ago, when I gave them a high-fat diet, they had more exacerbated features, because we know inflammation plays a key role in macular degeneration. So it was kind of like the missing link of how do you connect the environment and diet with disease in the eyes. And now we're using specialized animal models, and we're sure that this is true, that the diet changes the microbiome, and the microbiome changes the immune response in the eye, and that can change the disease progression and disease manifestation. And there's some early evidence from patients that people with macular degeneration, either the advanced forms or the more intermediate forms, had different gut microbiota composition for patients that are controlled, which basically are people of similar age and similar health status, but do not have macular degeneration. So both the lab evidence and the clinical evidence shows that gut microbiome may be one of the missing links and one of the missing pieces of the puzzle of macular degeneration.
Okay. Do you know if the microbiome of the eye is changing in macular degeneration, or do you think it's really mediated by the
Nobody
gut?
has looked at that. So actually, we're starting studies to look about that. Nobody has really looked about the surface of the macular degeneration patients compared to control. So the study so far has been focused more on the gut and also the mouth.
Is it hard to do? I mean, to get
first of all, it's that, the outside of the eye doesn't really communicate with the inside of the eye that much. The blood flow is different. So people went more to the core of the microbiome biomass that we know for sure affects inflammatory response and a general immune status system. The only problem with the ocular cells microbiome, because as I told you, it's very few microbiota, you cannot get a lot of them, and the studies are not so easy. But the sequencing technologies and the sensitivity of the assays now compared to 5-10 years ago when the field started is much better. So we are hoping with the new advanced sequencing technologies that we'll be able to address that question as well.
Okay, what particular research are you working on? Like, what are you hoping to figure out?
So my research is, first of all, in order to answer the basic questions about does the gut microbiome or the microbiome plays a role in the retina diseases, and why is the direct effect between microbiome and different microbiome status and different species with pathways in the retina, you need to use what is called the germ-free mice, which is considered the gold standard. So basically, these are mice that are completely sterile. They have no microbiome at all anywhere in the body. And this is the gold standard to answer the basic questions of yes or no. The problem with that is that mice are very difficult to handle, and you can not really manipulate them because they're going to get contaminated. And even though in most other organs they develop animal models of diseases using the germ-free mice, that was a big kind of like missing piece in the eye world. And luckily, my team working with these amazing specialized veterinarians, and especially Barry Theriot here in Mesh of Chicago, then we have one of the biggest and most advanced germ-free facilities internationally. We developed the first ever developed in the history animal model of macular degeneration using germ-free mice, be able to keep in the mice sterile. So that was a very big step that, to set the basis to create the standard and the gold standard for any future study. So now that we have that, we are actually seeing that a lot of significant pathways in the retinas of the mice that have no microbiota are very different than the mice that have microbiota or they have different microbiota. So
what kind of pathways, like
so it's inflammation pathways, metabolic pathways, angiogenic pathways, metabolism pathways, circadian clock pathways. We've seen all sorts of pathways that will be directly affected from the status of the gut in the retina. These are like data that are evolving as we speak, so we don't have the final conclusions yet, but the first evidence is it seems that the gut retina axis is really there.
How much of a lack of regulation is there in the germ-free mice then? So if you look at a germ-free mouse, I mean, how abnormal does it become over time? You don't have the bacteria there that are, doing the jobs they need to do.
But overall, pretty much, these mice develop normally. There are some small changes in, the intestine, but the eyes, we've done histology so far, and we don't see a big difference in the way the eyes developed without the lack of microbiome. It's more like in a microscope in a cellular level that there may be changes, but structurally the eye looks similar, and we've done histology and look at these eyes under the microscope, and they look grossly normal. But we're looking at the cellular and microscopic level to see what the specific gene expression pathways are involved. So that's one aspect. So, and then another aspect is, it seems like the microbiota affect the disease, but how do you use that to help patients and treat diseases? So actually my lab is working in using medications that we know that can alter the microbiota, and they're already FDA approved and safe, and they are used in other diseases, and they seem to be protective in other aging diseases. And this seems that they work mostly by promoting a healthy gut microbiome. How that can help and prevent or suppress the disease in animal models. So that's another aspect that, first of all, delineates the pathways involved between the gut and the retina axis, but also what happens when you alter the gut microbiome using already approved medications for other indications, and if that we can find basically a new way to prevent and treat macular degeneration.
Okay. Is there any, are there any therapies that can, reduce the problems of macular degeneration or even cure it? Or we know
Right now available? Right now, the only FDA-approved medication is if you get wet, which is only 10% of the patients, then you get an injection of a medicine in your eye every week, every month for the rest of your life. And this is what I do most of the days. I see patients, I give them a shot in the office, sitting awake on the needle in the eye, and they have to come and do that every month, basically, for the rest of their life. And despite that, they still slowly lose vision. So we really don't have much. So for the dry form, we have no treatment. And for the prevention, the only thing that we can offer them is a multivitamin supplement that, if you have specific criteria in the early intermediate stages, if you take the supplement, it may decrease your risk a little bit over 5 years to convert to the wet, but it will not stop the progression of the dry. So not much. So there are many other treatments that I've tried to prevent or stop the advancement of the dry, and so far they've all failed. There was many trials that have failed to prevent the disease or stop the slowing of the dry so far. So we really need for something new, and I think if you ask my interpretation of why we had so bad luck for that, is because it's a very complex disease, and if you're trying to break down and suppress only one molecule or one pathway, other side pathways will kind of compensate for that. And that's why it's so hard for this multi-complex and multifactorial disease to break one molecule, one pathway, and then stop the disease. So an approach that, by changing and promoting a more healthy microbiome, that will affect multiple pathways and multiple molecules at the same time, it's more likely to really make a difference. So I think that the idea of finding which are the good guys that are missing from the gut of people that have macular degeneration, and which are the bad guys that we see more, and trying to find a way to keep the balance between the good and bad guys on the healthy side, it's more likely to prevent such a multifactorial disease with multiple pathways involved than one single molecule.
That makes sense. What about, we haven't talked about it much, but retinopathy, what happens there, and any insights?
What retinopathy? The prematurity for the premature babies or diabetes?
Diabetes, actually. Diabetes.
So diabetic retinopathy, again, there is only basically one group that be working on that, and they have shown that when you alter the microbiota composition and you induce diabetes to animal models, then you have you seem to protect them from the diabetic retinopathy progression in a microscopic level. So it seems again that the gut retina axis and many of the pathways involved in diabetes are involved in macular degeneration. So it's another confirmation that the gut retina axis exists, and that by modulating the gut microbiota, you can modulate disease processes in the retina, either that's from diabetes or macular degeneration or inflammation like uveitis. Or retinopathy of prematurity, again, this is very early evidence that we have in babies.
Okay, so, well, with diabetes, it seems like the prevalence of sugar and the insulin resistance, is obviously a huge factor.
Yes.
So, any crossover in, high-fat diets like you were talking about before with macular degeneration and alteration of pathways and retinopathy with type 2 diabetes, or do they look very different?
I haven't done any particularly high-fat diet experiments, and I've done diabetic retinopathy experiments in rats during my PhD. I haven't done in particular, but other researchers have really affect diet changes induced on the gut microbiota and how that affects retinopathy. So yes, the same effects of gut on the retina seems to be also be the case in diabetic retinopathy using animal models. But again, this is a new field that we, there's not much out there. It's just we're just beginning to really thinking of the gut when we're thinking of the retina. This is kind of out of the box thinking that now becomes part of our explanations for many of the diseases. The same with glaucoma. there's early evidence that the gut microbiota status affects the optic nerve regeneration and neuroinflammation biomarkers. So it's all new. It's all new, and we're all like evolving knowledge every day as we speak.
With the theory that the gut microbiome affects, let's say, the eye, is it affecting the eye and that the gut bacteria are affecting the gut cells of our body, and then those cells are talking to our eye cells? Or do you think it's bacteria to bacteria communication or bacteria to distant somatic cell communication?
So there are two ways that are speculated so far and shown through evidence. One is by it's very well known that the gut microbiome controls the immune system. So, and many of the diseases have inflammation and the immune system as part of their pathogenesis, part of the ways that drives the disease. So one way is because different gut microbiota status control the regulation of the immune system, and if your immune system is dysregulated, that can make you more prone to disease in the eye. And we know that inflammation is one of the key factors in macular degeneration, in uveitis, in glaucoma, and in other diseases. Another thing is that all these microbes, they secrete all these little metabolites, and these metabolites, they circulate all over the body, and they can reach even the most distant parts of the body, and they can interact with receptors and the organs and the cells in distant places. So that's another way that can affect places like the eye. By changing the immune system, and the immune system, the immune cells travel to the eye, or by the metabolites that travel through the blood to the eye, and that can either activate the immune system in the eye or directly interact with with the receptors of pathways in the eye itself.
Okay, so it's the thought is it's all immune modulated type action.
Immune modulated and metabolite modulated, like specific metabolites like small chain fatty acid, the very small molecules, they're secreted, they pass to the circulation, and then they can travel in with the body, and then they can interact with specific receptors on the cells of the body.
Okay, all right. Has there been any observation of like microbe to somatic cell direct interactions, or do you think it's just the release of metabolites and other factors that are picked up then by somatic cells? Or
the more directly ocular surface microbiome, because it's the microbiota of the disease, the microbiome of the surface where the disease develops. So I think that in models, in diseases like ocular surface disease, like dry eyes or Stevens-Johnson, it may be more likely to be a direct effect of the microbiota itself on the disease itself and the local regulation pathways itself. For the retina, because there's no really microbiota inside the eye, or at least if there is, the minimal, it's more like through regulation of immune system and metabolites that then affect the retina.
What are your thoughts on your wins or knowledge or insights that you're research that you're doing and your colleagues are doing?
I think that there's several aspects of the research. First of all, it helps us understand better what we're dealing with. You cannot cure something you don't understand. So many times they ask me, well, why are you doing this? How are you gonna cure blindness with studying the microbiome? And the first answer I say is that you need to understand what you're trying to cure and what you're trying to prevent. So first of all, give us a much better understanding and it's filling the gaps we have in our knowledge. Number two, we know from epidemiological data that, Mediterranean diet, it seems to be protective, eating heart-healthy vegetables, a heart-healthy diet, and nuts and fish protects for AMD. And it's possible because this more healthy diet promotes a more healthy gut microbiome, why this protects for AMD. So it helps understand the disease, and also it understands better other things we can potentially change in lifestyle recommendations for our patients, especially when they're earlier, before they go to advanced stages, that may decrease the risk for macular degeneration. But maybe we should be more targeted. Maybe we should particularly tell them, make sure you don't eat high-fat diet, every day, or, not just try to eat healthy, and it's kind of like vague. Or, these patients are older, they get antibiotics all the time. Maybe, we don't know that, but maybe we should tell them, okay, when you do that, you should take, supplementation with healthy microbiota. Fecal transplantation is becoming more and more expanded in other fields. So if we come to the point that we think that specific population of microbiota seems to be protective. Who knows, maybe in the future, when their patients are in early stages and we see they have the high risk microbiota, we can recommend the fecal transplantation of a healthy population, and that maybe will protect it. Or design medications that, or use medications that can modulate them. So there are many different aspects we can really help our patients understand the disease, so we have better chance to find something to stop it. Help us understand better the recommendations we give them for lifestyle, and also explain why the lifestyle changes affect how your eye develops disease, and also design personalized treatments for patients based on specific gut composition, and then address it either with things like transplantation, metabolites, supplementation, or medications.
Okay. All right. Very good. So what's the best way for people to find out more about your particular research and get in touch with the lab or you?
There is a page on the website of University of Chicago, and my email is on the webpage. I have a very open access approach. I give my email to everybody, and patients can email me directly either for research purposes or for patient advice. And we also have published a few press articles in lay terms about the work we're doing about the effect of microbiota and the eye disease. And also we have a very comprehensive review about the effect of microbiome and ophthalmic disease that was published last year, that overviews microbiome and the effect of microbiome in the front of the eye and the back of the eye, including our work and other people's work. So that would be a very nice overview of what we know so far and where we're going.
Okay, very good. Well, Dimitra, thanks for coming. And it's interesting you're looking at these things. A lot of people aren't. So, again, thanks for your knowledge and time.
Thank you for having me. This is a great initiative, and we all appreciate bringing awareness to this interesting and upcoming topic.
You've been listening to the Future Tech edition of the Finding Genius podcast. This podcast is information only. No advice of any kind is being given. Any action you take or don't take as a result of listening is your sole responsibility. Consult professionals when advice is needed. Review us on iTunes or wherever you listen, and subscribe today by going to futuretech.findinggeniuspodcast.com.